All right, so we're quickly trying to move to the next issue. Next concept as related to respiratory distress syndrome. So this is differential diagnosis. Okay, so differential diagnosis for respiratory distress syndrome. Okay, so differential diagnosis is more of like, okay, you are so much suspecting that a patient has respiratory distress syndrome, but if it is not this respiratory distress syndrome, what else could it be? Okay, so it's always good for you to have your differentials, because it's not the disease mustn't always follow what you are suspecting, right? So differentiating respiratory distress syndrome, especially in neonatal adults, requires careful considerations. Okay, and key differentials: if it is not respiratory distress syndrome, it could be cardiogenic pulmonary edema. Now please, you can check the key features of the disease condition and how it actually differs from that respiratory distress syndrome. That's how you can be able to tell the difference. It could be pneumonia, it could be pulmonary embolism, it could be aspiration pneumonitis, it could be interstitial lung disease. Okay, it could be COVID-19 pneumonia, it could be diffuse alveolar hemorrhage, it could be idiopathic pneumonia syndrome, it could be neonatal transient tachypnea. So please do me a favor, pause, look at the key features, look at how it actually differs from the respiratory distress syndrome. Okay, also here, okay, key features, how it actually differs from the respiratory distress syndrome. Okay, so that's it for the differential diagnosis, meaning that if it is not respiratory distress syndrome, it could be possibly these other disease conditions.